Here, children's mental health is more than their grades. A very good evening to everyone. We are like in live with a very beautiful session. The need of mental health for children. For this topic, we have a very special guest today in our dice, Mrs. Tania Chatterji from UK. She has been associated with mental health field since many years. She has worked with different aged groups for different problems like anxiety disorder, personality disorder, bipolar disorder, etc. She has also worked in Innolan Private Limited UK for the special needs of children. So, to discuss more about the need, impact of today's mental health and emotional health for your children, we would like to invite ma'am to our dais. Welcome, ma'am.
Thank you for inviting me, doctor.
Thank you, ma'am. So, start the topic with a brief description about the children's mental health.
Okay. Yeah, mental health is as important as physical health for children, not only for children, but for everybody in society. But it's very essential for children because they are our future shining stars. Like they will lead our earth to a better place to live in. So, good mental health, I think good mental health allows a child to be resilient, to cope up with whatever life throws at him or her, and good mental health helps a child to be socially very skilled. Then they can learn a lot of skills effectively, and they also develop social skills, and they can grow up into well-rounded and fully functioning adults.
So, ma'am, mental health is very vital and important for every child. Is it?
Hmm.
Why?
Yes. Sorry, doctor, I couldn't get you.
Why mental health is very vital for children?
Mental health is vital for children, as I just told you, that it helps them to grow up. It helps them to think very clearly. It helps them to develop a lot of skills in them, and also they grow up into proper well-rounded adults. uh, and is, as you know, that physical health is very obvious. Like we can understand our child's needs, physical needs, very clearly, like when they are sleepy or when they are hungry, so we fulfill their needs accordingly. But as mental health is not always obvious to understand, so we should be very careful in understanding or looking in seeing the signs in our children, like when to understand if a child is suffering from any kind of mental disorders or emotional illness.
Ma'am, uh, from which age group? Yeah, since the starting, see, at different ages, we are facing different types of mental and emotional problems. So, for specific a child, in case of a child, from at what age we should be aware as a parents, we should be aware of their mental health.
See, I personally feel that from the very childhood, we should be very careful about our children's mental health. You know, as Freud has said, that our child's personalities develops from the from the very first day he comes to Earth. So I also think that we should be very careful about keeping our child mentally well from the very beginning of his ages. Like I have seen that, or I have heard that many children are getting molested. Not It's not only the female children who get molested, but I think the male children are also getting molested from the very past days. Like what I have seen is that there are many family members who play with the a male child's genitals. Is it right? I think it's not right, because a person's genital, whatever age group he or she might be, is a personal property. So nobody should mock at it, or nobody should play with it. it should be kept as private. It should be like behind the doors, like when we are changing our child's diapers, or when we are changing their clothes when they mess up their clothes. So it should always be behind the door. We shouldn't be changing them in front of anyone. And we should always teach them that you should not change your clothes, or just take your bath and come out from in front of everybody. It should be a personal thing. They should be behind the doors.
Definitely. Ma'am, what are the risk factors behind the mental health issues, specifically children?
Okay, the risk factors are, look, when like if a child has a long-term physical illness, if a child has long-term physical illness, then a child is very much prone to develop some mental illness as well. Because a long-term physical illness, such as a cerebral palsy or epilepsy, what happens is that they feel so much physically fragile or vulnerable, that they think that I might not be able to cope up with children of our ages, of my age. So this becomes a mental pressure to them, and they also might develop learned helplessness from their physical illness, that they stop trying. When they feel that I won't be able to cope up with the others, then they stop trying. This can be a risk. And like mm, even having a parental history of substance abuse, especially alcohol, it also can create a lot of mental issues in children. And then comes genetics. Like if a parent from a family, if a parent of a child is suffering or has suffered from some mental illness, then the biological factors also can affect in a child's mental health. And he also might get affected by his or her parent. Then comes broken families or separated parents. It also creates a great impact in children's mental health when they see, like what we think, what children think is that their parents as a form of security. They think that the parents are a protective shield, like the ozone layer is, like and if one parent gets out of the house, gets separated, when the parents get separated, when they see that the parents not happy among themselves, then what happens, their shield, that protective shield gets broken off, and they start feeling insecure, they start feeling depressed, sort of anxiety crops in them. So these are the risk factors which I think that it might affect, or it can affect the children of every age group.
Definitely, ma'am. Do you think that today's educational system, educational curriculum, which is starting at the very early age of every child, is it affecting mentally for the students, yeah, children at the early age group?
See, our generation children are quite, no, are quite advanced than what we were in our days. So I think yes, encouraging them to study or encouraging them to be a bit more advanced is not a bad thing to do. But yes, we should be knowing, or we should be aware of what or how much a child can intake. Like, every child is not same. Every child does not have similar IQ level. So we can't expect one child like doing very good in one subject, whereas the other child is cannot cope up well. So we cannot always blame the child for not being able to cope up well, so because the IQ level is different. So yes, it's necessary that the school or the educational people should decrease a bit of pressure in them. And nowadays the pressure, I also have heard since the last few years, that the increasing pressure is creating a lot of depression or anxiety in students, for which a lot of suicides cases have been seen. That should be taken into account, that a little bit of pressure, if it could be decreased, then it would be very good for students to cope up.
One more thing we are seeing in the society and every family, that children at the age of in between 2 to 5 years or 6 years, they are very naughty by nature.
Hmm.
They are always trying to disturb, yeah, busy in doing some things which is not preferable by the parents. They think that as a adult, they think that their children, yeah, their child should be quiet and peace, and they started yelling, yeah, biting the childs. Is it affecting also the mental health of the child?
Yes, of course it is affecting, because we can't expect our children to be quiet and to be like zombies at that age. They are bound. They are supposed to play, and they're supposed to be naughty at the age that you have just mentioned. And parents nowadays are like both are working, and both are very busy in pursuing their career. So it also affects a child. But yes, I'm not saying that parents shouldn't work. Like both the parents shouldn't work. Yes, they must. They should work, and like rather than just telling their children that I am doing this for you, for your betterment, for your future, I think they could just use the term, or they could use phrases like it makes me happy when I am in my job, when I am pursuing my career. And they should also like realize, they should also make their children realize that they should be proud of their parents who wants to pursue their career rather than sitting at home always. They should be happy, that the children should be happy about their parents and also feel proud that my dad is a doctor, my mother is an engineer. They should be very proud of the fact that their parents are working and they're happy in their field, in their career.
Definitely. So, ma'am, there are many types of factors, risk factors you have just mentioned. Let us discuss about the solutions.
Okay. Mhm.
In which way we can take care of a child uh, affecting with different risk factors.
Yeah. See, I think parents and teachers, the both the fields, schools and home, they play a major role in a child's mental well-being. First of all, I think that being acceptable, parents being acceptable of what their child are, of how their child are, of how they look, of whatever, no matter what their accomplishments are, parents should always be acceptable to like to their children, and they should be the children should be understood and also be listened to. I think parents are so busy at their work, so and they don't usually get time to listen to their children. But at least when children come and wish to tell something to their parents, they should be mindful listeners. Then I think it will get a bit more helpful for the parents to understand if a child is facing any kind of trouble at uh, at school or outside their home or with any other family members. This is one thing. Second thing, I would like to say that unconditional love is very essential for a child, because every child thinks that our parents, my family is a place where I can go and I will be accepted for no matter what I am. So unconditional regard, unconditional love is very essential. The parent should be honoring the child. What's the meaning of honoring the child? Honoring the child doesn't mean that whatever you do, I'm accepting it. No, it means that you just share the message to your child that I love you no matter what you are, but I don't accept your behavior, what you have done. So let's address it. Don't think that I don't love you, I love you. This should be the message. And keep on smiling. Parents should smile. What children want is that children want a happy home, filled with love, and the parents should be happy. So I think you should give smiles, regular smiles to your child, and say you love them, how much you love them every day before going to sleep. This is how we can always like look after the mental health of the children, and be and make them happy. And then teachers are also teachers also play a very important role in children's mental health. How? By giving them an encouraging atmosphere, because teachers are second mothers to every child. So they should be encouraging them, they should be motivating them. They should always listen to what if a child comes and complains about someone or something that has happened in school, they shouldn't just push them away and just say that no, it's nothing has happened. Believe the students what they have to say. It's a very important thing. And the teacher should be very keen, very should be very careful in choosing the words that they use for the child, because we should remember one thing, that every child is listening to whatever you are saying. So you should be very careful in choosing your words. Because I would like to share a personal experience. Like what happened in my school was that we had a teacher who was a bit strict and used to use harsh languages, or used to beat up children and used to punish them severely. So I have a friend, a very close friend of mine, who was in class 4 or 5, and one day she forgot to bring her pencil box in the school. When she complained that, when she said that, ma'am, I forgot to bring my pencil box, and could I borrow some pencils from my friend, the teacher was so arrogant, and the teacher just said that, oh, you did not bring your pencil box because your father is a beggar. This language she used, and this phrase has affected my friend so much that she still even remembers today, even after so many years. She still remembers it, and it has made her to a very shy, very shy girl, and she is still ashamed of that day, and she still says sometimes that this had happened before, and I still remember it. So you don't know when one word or one phrase affects a child for lifetime. It can scar a child for lifetime. So you should be very careful in choosing the words, and it should be very encouraging and motivating as well.
Definitely, ma'am. Ma'am, there is a question you can see on our screen. I would like to know, how does parents' mental health affect the child? From Ria De.
How does parents, right? I couldn't see
Yeah.
the
How
question.
does parents' mental health affect the child?
Okay, the parents' mental health. Yeah, parents' mental health. Like if a parent has a history of mental illness, first of all, the genetics affect the child, that we know very well. Uh, there are two factors as in nature. I mean, the biological factors and the environmental factors. So the biological factor, if a parent has some traits of mental disorders or has some disorders, the child might get some symptoms or some traits from the father or from the mother. The maybe a schizophrenic father, is a schizophrenic father at home, or a bipolar father at home, the child might inherit the anger issues of the father, or some other traits from the father. I'm not saying that the child will get the disorder, but he or she might get some traits from the father or the mother of the child.
Definitely, ma'am. Uh, we are seeing many things happening in the school curriculum at the early age. Just I have told you before. Uh, Let us the environment in schools be like comparative and comparative, not competitive. Means when one child performs better, then the teacher or supportive staffs encourage his or her and neglecting the other child who scores less marks or less grades, and this also creates a very damaging situation to the emotional and mental level of a child. So how can you describe it?
Yes, see, I think nowadays things have changed a lot. There are school counselors, there are educational psychologists in every school, I guess, and even teachers undergo many training programs. They learn to not criticize a child, or not criticize the child's behavior or the poor grades that they get. It's very essential to be to be not partial among students, that if or not favoring any student, they should be equal. Like all children should be equal in the eyes of the teacher. As I have said, that unconditional positive regard is very essential, because teachers are also like mothers, right? They also have children in home, so they should be also regarding them as their own children, and not be partial to anyone, and be very much encouraging and motivating. Like if they know that a child is having some mental or emotional illness, they should be very much cooperative. The teachers and also among the non-teaching staffs, they should communicate among one another to create a proper environment for a child who is suffering from a disorder. And even if they find out some sudden changes in a child, they should always communicate with the parent of the particular child of what is happening, rather than criticizing the child of their poor grades, of their behavior. They should always communicate with the parent that there might be something happening at home as well, so for which the child gets affected, or for which the child's behavior or the performance has gone down. So they should be communicating with the parents as well, to find out what actually happened to the child. So do not criticize the child, or yes, you can criticize a child's behavior, but not a child, because we should learn how to separate a child from its behavior. That's very
Definitely,
important.
ma'am. For a mental health well-being of a child, there are many factors affecting, many factors are responsible. As a person, as a society, we should be aware that parents has its role, teachers has their role, and also among parents and teachers, society has also its role. So let us
Exactly.
discuss one by one what are the steps parents should take for the well-being of their child.
Okay. Yeah. See, the parents should be taking care of their physical health. In the physical, they should be letting their child or encouraging their child to exercise regularly, because because the mind and body are interlinked among each other. So you should be very careful to keep our physical health good as well, because if we are physically ill, I think the emotions as well and the mind will not work properly. So regular exercising, maintaining a proper diet is very essential for a child's mental well-being. Then secondly, it comes to fighting or arguing in front of the children. We find many parents, they're arguing or fighting in front of their children. What I want to say is that this fighting, arguing, yes, of course, the parents can have disagreement among themselves, and they are not like God or goddess. They can show it in front of their children. Sometimes it comes out basically, but exhibiting such negative emotions in front of your child, when you're not shameful of exhibiting such emotions in your child, I mean in front of your child, then why are you shameful of just apologizing or saying a sorry in front of them to your partner? When you can fight in front of your child, I think you should be also telling a sorry to your partner in front of your child. A hug or how much you love one another, I think that's a very positive thing to show and to imbibe in your child. Like we parents say that do not fight among your friends, or just go and tell a sorry to the person you have done a mistake to. So when we as parents cannot portray that how much sorry we feel when we fight among one another, then what will they learn from us? Because children doesn't learn what we say, they learn what they see, right? I think that's a very important thing that the parents should be careful of. And the role of the teachers is to motivate every child to invent or to discuss, to create some play ideas where children can get motivated. And if they have something to say, or if one child is severely bullied by another, we should be communicating with the child, or with the children by whom a child is bullied, and the child who is bullied. So we should be communicating, and we should make them understand that bullying is not a good thing to do. And even we can talk to their parents that when a child bullies another child, they might be that the child who is bullying might be facing some problems at home as well. So that's the reason why they are taking out their anger or their frustration in other children. So they should be communicating with their parents. And if a child is facing any mental disorder, they should take proper care of them, and they should create a close knit thing, a unit, so that the child gets proper environment, and nobody criticizes the child, even if the child has some physical abnormalities uh, or mental abnormalities. The school should be a close unit where the child should get a very secure environment.
Ma'am, another question is there. I am a
Mhm.
teacher and parents often ask me that their children are very stubborn and gets angry whenever something doesn't happen according to their wish. I would like to know how to deal with such attitude to help them become disciplined or obedient.
Okay. See, even I have a child of my own who gets too much, no, who throws a lot of temper tantrums, and at this age he's just 1 year old. And yes, last time, like in a few days, I have seen him throwing a lot of temper tantrums. But what I realized is, when he wants to do something, I used to say a no to him, that you shouldn't do that, you shouldn't. I always use the word no. But I realized that why should I tell him a no? Why can't I say him a yes? So I think telling no always, it creates a lot of frustration in a child, because they are very inquisitive, they are very curious of everything at this age. So they should be given the opportunity to explore the surroundings. So what did I do when, like, the last few days, what happened was that uh, like it was out of schedule, and he came up to me with his both the shoes and was asking me to put it on him, and so that he could go out. So I would have said a no, but I thought to myself that why should I say a no? Why can't I go out with him? Even it's out of schedule. Yeah, I also can get a walk, get a walk, and just freshen up my mind. So I took him, and there was no temper tantrums. So I would suggest that avoid telling no's as much as you can, though that shouldn't be interfering or meddling up with the discipline that you want to put in your child. When you are trying to discipline your child, don't lie that I'm doing this for that. Not like that. You should be explaining to them the proper reason why you are trying to discipline, because the consequences of their behavior might lead them to danger if they are not being disciplined well.
Definitely.
I think that
Ma'am,
can.
what,
Yes.
yes, what are the mental health problems or disorders specifically children are suffering?
Yes, according to me, there are 4 to 5 disorders commonly which occurs in children, like post-traumatic stress disorder. Then comes anxiety disorder. Then comes self-harming themselves, and then comes ADHD and depression as well.
So who can help them in these scenarios? Parents
First,
or
the
teachers?
parents. Yes, the parents can help them in a great way. Then comes the teachers. As I said, the teachers are the second mothers of the children. And if parents and teachers see that it's beyond their capabilities of treating the child from the disorder or from the signs that they show, they could take them to the professionals or to the uh, psychologists. And even if that's the disorder is much more disastrous, I think then medication is necessary for every child.
Ma'am, we have worked for special needs children in UK.
Hmm.
Can we get some exposure in the scenarios if we compare about the mental health issues of children, specifically in India compared to UK?
Yes. See, it's a major difference in the children of India and the children in the foreign countries like UK, because I've worked with children with special needs who were who were coming from the broken homes, or who were coming from a history or background of substance abuse, or even there were some children who were juvenile delinquents. I've dealt with these kind of children. But yes, even normal children are quite different from the children of India, because we parents of the parents of India, like we're very protective of our child. We always, basically, we're obsessed with our child. We keep on nagging. We keep on treating them as children even when they are grown up. But here it's quite different. The parents just let go of them, and they trust their child, and uh, they just leave their children to whatever they feel they wish to do. Like I have seen myself forcing my child to eat when he doesn't feels like eating. But here in UK, they just leave the child. They just say that, okay, fine, if you don't want to eat, then don't. And I think that helps a child to learn that when they are hungry and when they are not, because we Indian mothers are just spoon feed them a lot. But yes, in India we are very closely knit, but in the foreign countries, children are not at all closely knit with their parents. That's the difference, I think. It's there.
I mean, in India, we are seeing that many private schools are hiring psychological counselors or psychologists or counseling psychologists to for the mental well-being of their students. But somewhere we are lacking in that system in our government schools or colleges. So, what are your views regarding this matter? Is government should be aware of this topic?
Yes, the government schools also should be keeping, I think, counseling psychologists for for the betterment of the students. I think even the universities that I have worked in, I mentioned it. Like, I was working in Macaut
Yeah.
in India. So there's a government university, and it hired me because I think that time the rule was there to start hiring school counselors. So I think it should be a very important thing to do, and they should be keeping school counselors for in every school for the betterment of the children.
Ma'am, one last question.
Mhm.
In today's society, what I have felt in many families, parents are worried about their child's performance grades, comparing with their neighbor students, neighbor child, without having a much giving the importance to their mental health or emotional health. For that purpose, many childs are suffering also. So, what will be your last message to specifically parents?
Yes. My last message would be always remember, parents should always remember that your child is the best. Do not compare your children with any others, because everybody's IQ, everybody is not that much gifted with intelligence or any other factors that there is in another child, while you see that it's absent in your child. Do not compare your children with the others. You should be loving towards your child. Give them unconditional love, which will help them grow, which will help their brain develop very well. And if you give them love, then only they will be they will be growing up into well-rounded adults and fully functioning. They will be fully functioning, and they will also be learning to love you and also others in society. And love, we know that love is a very powerful emotion. It can attract everybody, and if you share love, then love will definitely come back to you as well.
Definitely. Thank you, ma'am. You have given a wonderful session on this important, very important topic, which will be circulated later on different social media platforms, and it will be reached to the people, many people, from which they get many information regarding this topic. And the vital thing is the childs are our future of the nation. So taking care of the child in a proper way should be adapted for every families, for every parents, and also education system. You have given us such a wonderful session, having your busy schedule, and
Thank you, Doctor.
despite of having many technical issues, we have completed one successful session with you. So, thank you for that also.
Thanks for inviting me here, and I'm really honored, and we really it's a pleasure to be here with you today.
Thank you. So, from today's session, we got to know what are the factors, what are the risk factors specifically for our child. So, it's a humble request to all the parents who are watching us live and will be watched later. Take care of your child, because they are your assets, they are your properties. So, taking good care of your child will be precious, very precious in your life journey. Your child's mental health is more important than their grades. Let them be little, let them be creative, let them play upon. In short term, let them be children. Treat a child as a child. इसे नोट्स के साथ हम आज के सेशन को यहीं पे समाप्त करते हैं. टिल देन, टेक केयर, बाय बाय. थैंक यू मैम.
Thank you so much, Doctor.